Okay, so now I'm going to do the second phase of our discharge process, which is completing the discharge plans by MD. This is done through orders. So I'm in the same test patient, I'm going to add a new order. It'll be a discharge order. And discharge plans by MD. This will open that power form, and there's the discharge now order. I'll fill in the details later. Here's the discharge power form that automatically launched from that order. The discharge date will be today. The diagnosis was pneumonia. And I'll show you the CHF later. Let's say no. So the patient has CHF no. And they had a bronchoscopy. And they're going home. If they were going to a skilled nursing facility, that would go there. If they needed home health PT, for instance, that would go here. Here I indicate the diet, and here I indicate their activity level. Here I say weight monitoring is not needed. It was yellow, so that means it was a required field. I can give them additional discharge instructions here. And their follow-up appointment is with me, with someone with the same name as me in 1 week. And I'll give them the phone number of the hospital and the phone number of the clinic they're following up in. And I'll also remember that they need a CBC. They'll take this discharge. This will be turned into, as you'll see soon, a discharge document for a patient, and they'll be taking this to the lab, and that's how they'll get their CBC. Consults to schedule, I'll skip. Call provider if you experience shortness of breath. The provider to call with medical questions would be their PCP, and I'm the one doing the discharge. I'm the one doing the discharge, and I'm the one doing the discharge summary. And I contacted the PCP I'm contacting on discharge is that doctor. I'll sign the form. And this is the ordering catalog window. I'll close that, and there's those two orders that I had written, remembering that this first one launched that power form. So now I've finished the power form, I'll do the order details and say that the anticipated discharge date is today. That blue circle with a white X means that there's a required field, and that was this discharge date today. And then as far as this discharge now order, I have to say where they're going home. Their discharge prescription status, you remember from the prior one, I took care of that. Those were faxed to the pharmacy. Their discharge plan, that's what I just completed. And the med reconciliation note I showed you in the last video, that's been complete. So now I'll sign the order, and the patient is discharged. The power form I used created the following document. I'm clicking on menu again, and here it is, view discharge instructions. And so the output of the power form is this document here, which the patient takes home.